So, platelet-rich plasma, what is it and how does it work? So, PRP, or platelet-rich plasma, is a procedure that takes about 30 minutes. We basically take blood from your arm and then we process that in a machine that separates the blood into layers. We take the plasma layer that has the platelets and all the growth factors, and then we inject that into the problem spot. And what we're essentially trying to do is stimulate a new injury. We're trying to stimulate a healing response by telling your body, like, hey, there's something going on over here. And the way that I tell patients is when you get injured and blood vessels will break, those platelets in your blood are the first thing to jump into action. Not only do they clot if you're bleeding, but they also secrete all of the chemicals that tell the cells in the area to come in and start a healing process. And it takes stem cells that are in the neighborhood, and those cells can differentiate into the tissues that you need. And it also stimulates increased blood flow because that's how we heal, is with blood flow. So PRP can be introduced into tendon problems, ligament problems, meniscus tears if it's the right kind of tear. And what that will do is stimulate the healing response and resolve the problem completely because it tells your body to get in there and start a healing process. Even in cases where the tendon or ligament is degenerative because of chronic inflammation, PRP can be effective in having your body completely heal that degenerative tissue instead of needing to go to surgery. It lasts longer than cortisone injections, also tends to last longer than viscosupplementation for arthritis, but it's a slower process because unlike cortisone, for instance, which is a drug and works fairly quickly, this injection will stimulate a healing response, and it generally takes several weeks to have its effectiveness, but it can last for several months and potentially even longer than that depending on the case, and it potentially could resolve and completely heal the problem.